Have you ever wondered what the first visit to a chiropractic office is going to look like? I'm Dr. Garst with the Well Chiropractic Clinic, and I'm going to walk you right to our new patient room so you can see exactly what you should be expecting when coming to one of our offices. We have 3 locations in the East Valley, 2 in Mesa, 1 in Gilbert, so pick the one that works best for you. But right now I'm walking back to our consultation room. This is a pretty standard office for most chiropractors, but why this one's awesome for us is we have x-rays on site. We are going to do all the orthopedic evaluation, chiropractic examination that we need to do in this room. Our front desk is going to bring you back here, get you nice and comfortable, make sure you have plenty of water, all those kind of things just to get you used to our office. But during that first visit, there's going to be several things that we need to check off before we can start doing chiropractic care. One, you're going to get a detailed consultation with one of our doctors. This is super important because we're going to ask questions like, how your injury came about, what's been going on, what have you tried, what has worked, what has not worked, injuries in the past, what you do on a daily basis, all of those kind of questions so that we can get a very good understanding of what's been happening, maybe what caused it, and what we need to be doing to address it in the future. Chiropractic examinations are key too because we're going to test things like range of motion, maybe an orthopedic examination. We're going to be doing some muscle testing. We might do some orthopedic tests to figure out if it's your SI joint, if it's your neck, if it's a disc issue, things like that. Like I said a minute ago, x-rays are super important for us because just like a medical doctor is going to want to look at some blood work before recommending some certain care, we're going to want to look at some x-rays. Now, this is not universal. We're not going to take x-rays on everybody, but very common in our practice to take x-rays on a lot of our new patients. Once we take the x-rays and once we've done our physical examination, it's not uncommon for us to then start with our first therapy. So I'm going to walk you into that room here, just right next door. Really simple, really easy. We have several therapies in our office that can help manage pain, get people feeling just a little bit better before we start recommending care and going over the treatment recommendations that we will have for that patient. Things like decompression, but we also have things like stim, ultrasound, hot packs, cold packs, vibration plate, all those kind of things, again, just to ease that little bit of pain in the beginning or to jumpstart how fast we can get you on a corrective plan. Once we do that, we will typically send patients home. Why? We want to make proper recommendations before we start throwing a bunch of care at people, and we want patients to understand what that's going to look like. Every patient is different. Some patient might need 1 adjustment, some patients might need 20 adjustments. It really just depends on the patient, their injury, and how long we think it's going to take to get them better. But we are always very clear to make sure we go over that before we start adjusting people. 1, just so that expectations are met. 2, that we give them the best care possible. And 3, that we get them the fastest results that we possibly can. So that's what a typical first day is going to look like in our office. If you have any questions or want to know more details about that first day, let us know. We'd love to see if we can help. And then we're always running a new patient special or something to make sure that we can give you guys the best value and best care for the offices that we do and the treatments that we provide. So if that's interesting to you, feel free to give us a call. We look forward to seeing you guys and hope this helped you out on your very first day.